Chat. I've not been taking this as serious as I should have been. I'm gonna be honest. I had looked some of the marks yesterday for passing. If I just bring them back up so I can remind myself, that'd be good. In the past, the marks have been around 79, 82, 83, 77, 83. So an average of like around, let's say 79 to 80. I'd say 80 average, and I have an average of, let's say, 77. Yeah, I'll go with 77, 76. Yeah, so I need to be comfortably clear, basically, and I'm literally like barely scraping a pass, which is not like, I mean, if I fail now, that's kind of all my fault because I haven't been properly. I don't know. I just haven't been feeling. Sometimes like in previous exams, I just like you just every day you could just go 12 hours, 12 hours, 12 hours. For this exam, I don't know why. I just haven't been feeling it. I don't know. It sounds so stupid, but I haven't. Um, but we'll see. All right. So I got some things written down yesterday. I just wanted to go through. Then we're gonna finish the Boots exam. Then I'm gonna do another exam, I think. So I think we should just get all those things ticked off my list. So we have adrenaline, paracetamol, ibuprofen, and amoxicillin. I'm not sure how I can remember the dosing though. That's the problem. Wait, if I all right, I'm gonna pull out this page. Actually, no, I won't pull it out yet. I'll write on it first, then I'll do it. I think the paracetamol dosing and the ibuprofen dosing. Let's just get that out the way. I think those are easy marks I sometimes miss now. I really wanted to go through OTC, but we've got like 5 days left now, or including this day, so 4 days left. There's 70 different things in here. Will I be able to go through them? I don't know. To be fair, a lot of this is missing. Maybe we could run through it quickly. But yeah, I think we'll get the ones done first that I have. So paracetamol, if we just type that in. This is crazy that I've been using 100% my website and mock exams. That's it, really. So paracetamol. The only thing I noticed we're missing dabigatran, which I kind of just searched about myself and found out this myself, which is like 110 twice a day reduced dosing. And it's 30 to 50 where you reduce it. Under 30 you don't even give it, whereas all the other ones you stop under 15, which is interesting. All right, let's see. Paracetamol, probably in here. Paracetamol pediatric dosing. So I don't know, how am I supposed to remember this? Every 8 hours. So 1 to 2 months, every 8 hours. That's 3 times a day. 1, 2 equals 30, 60 TDS. Then it's 3, 5 equals 60. So up to 5 months that's QDS. Then 6 to 23, is it 120? Okay, 120. So 6 months to 2 years, it is QD basically. 2 years. So then 2 to 3 years is 180. Okay, I forgot about 180 last time. That's why I think I got it wrong. QDS. So 2 to 3, you take 180. Then 4 to 5, you give 240. 4 to 5 has 240. Then this is the one that gets weird. I can't remember this. 6 to 7. Okay, maybe that's how I can remember it. 6 to 7. 6, 7 is 240, 250. 6, 7, 2, 4. Okay, QDS. Then 8, 9 is 360 to 375. This is also hard to remember. So 375 or 360 for 8-year-olds. So as an 8-year-old, you like the Xbox 360. Is that how I should remember it or something? 360 to 375. Then 10 to 11. 480 to 500. This is hard as well. I can't remember this. 480 to 500, and then 12 to 15 can have 12 to 15. 480. What weird those 480? 480 to 750. QD. Should I just get rid of like, I don't know. And then 16 to 17 goes 500 to 1 gram. QDS. So 16, 17 can have a max dose. So once you hit 16, you can have the max dose. Less than that, you can have 1.5 of the max dose, like 1.5 instead of 2 tablets. So 12 to 15, you can have 1.5 basically, but it's 480. Then 10 to 11, you can only have 1 tablet 4 times. Then less than that, 360 to these. Okay, 8-year-old 360. 8-year-old like a 360. 6, 7 is the other weird one, 240 to 250. So 6, 7, yeah, 0.5 of a tablet. Um, 10 to 11, you have 1 tablet, and 6, 7, you have 0.5 of a tablet. Gosh. So it goes 30 to 60, 1 to 2 months. 3 to 5 months, you have. 3 to 5 months, you have. No, 1 to 2 months, you have 30 to 60 TDS. 3 to 5 months, you have 60 QDS. 6 to 23 months, you have 120 QDS. Then 2 to 3, yeah, 2 to 3, I'd say. 2 to 3, you have 180 QDS. 4 to 5, you have 240. 240. 6 to 7. No, 6 to 7 is, yeah, 6 to 7 is 0.5, so that's 240 to 480. Is that how it goes? No. I missed out something, didn't I? So 2 to 3, then 4 to 5, 240. 6 to 7. 6 to 7 is 0.5 of a tablet. Oh man, I've messed up. Okay, I'm kind of getting it though. Okay, let me try and remember again. So 1 to 2 months, 30 to 60 TDS. 3 to 5 months, 60 QDS. 6 to 23 months, 120 QDS. 2 to 3, 180 QDS. 4 to 5, 240 QDS. 6 to 7, 240 to 250 QDS. 8 to 9, 8 to 9, 8 to 9, 480 to 500 QDS. If someone just said a random one to me, 6 to 7, I won't remember it though. I have to like go through it in order. That's weird. But 6 to 7, I think actually no, I think I can't remember it. 6 to 7, 240 to 250. Yeah, 240 to 250. 8 to 9, 360 to 375. 10 to 11, 480 to 500. 12 to 15. Ooh, actually, I think I got something wrong. 480 to 500. Oh no, I did get it right. There's 480 to 750. Oh yeah, 12 to 15 can have 1.5 of a tablet. Oh man, it's kind of tough for me to remember. Man. Ah. I'm kind of getting there though. So this paracetamol. Then I can get ibuprofen down. And then I Amox. Ooh. Hopefully that doesn't mess up my thing. Hopefully ibuprofen's more simple. Please be more simple. Alright, let's try again. Where was I? Alright, let's go from the start. Or should we go backwards? That would actually test me. So 16 to 17, 500 to 1 QDS, 12 to 15, 480 to 750 QDS, 10 to 11, 480 to 500 QDS, 8 to 9, 360 to 375 QDS, 6 to 7, 67. I think it's 240, 250 QDS. That's a big jump, isn't it? 8 to 9. No, it's not. Yeah, 6 to 7, 240 to 250. After that, it's 4 to 5, which is this just 240, I think. 4 to 5, 240. 2 to 3, 1. Ooh, maybe I got something wrong. Okay, 2 to 3, 180. 6 to 23, 120. 3 to 5, 60. Did I get it wrong? No, I didn't. Okay, cool. Okay, chat, I think I kind of know it. Hopefully I don't just forget it straight after this, though. Okay, let's have a look at ibuprofen. Do I have ibuprofen dosing on here? Triple whammy. third trimester, so that's after 24 weeks. After 20 weeks. 1.2 grams max OTC as an adult. Mm. Mm. Avoid CIN. Avoid in 20 weeks / third. Okay. I need to know the dose. Oh, children dosing essential doses. Is this for OTC? Wet nappies. What's that got to do with anything? Honey avoid under 1. I think it can. I can't remember why though. Botulism. So honey under 1. Codeine, tonsillectomy, and adenectomy. Avoiding breastfeeding. From 3 months and over 5 kilograms. Okay. Reyes syndrome. Okay, I got confused with Raynaud's. Reyes syndrome. Ibuprofen BNFC. Let's have a look. See. That's only from over 3 months, is it? Mm. 3 to 5 months. It has to be 3 months or older and weigh at least 5 kilograms. But if it's a younger, then the doctor has to prescribe it. Okay, so OTC one. I'm just gonna remember the OTC one. It needs to be 3 months / 5 kilograms plus. Stop giving me advice. Stop giving me advice. Stop giving me advice. And that one needs to be 2 months plus. I don't know why I make a flipping car noise, but All right, this is great. This is absolutely fantastic. Thank you for making it even more complicated than the paracetamol dosing. Oh my god. No. No. How the hell am I supposed to even... See wallahi, bro. See wallahi. So 50 milligrams TDS. Okay, so I'm gonna put 3 to 5. 3 to 5. 50 TDS. Bro, why is it so different? 6 to 11. This is so different. Wait, what? Are you kidding me? Oh, that one can be 4 times a day. Right? Bro, this is so dumb. Oh, okay. That one can be QDS. Okay, so I'm gonna put 50 TDS to QDS. But then the max dosing changes, so that's so dumb. Whatever, man. Then 1 to 3 equals 100 TDS. And next one is 4 to 6, 150. Ooh, it's going up in... Oh, kind of is anyway. Kind of going up normally. This is okay so far. 79. So it's going up every 3 years. 200 TDS. And it's going up by 50 as well. This one's not as bad. Paracetamol one. What was that, man? 10 to 11. Okay, now it's changed. 10 to 11, 300. That's a big jump as well. TDS. 12 to 17. I'm gonna be real. I don't know if I'm gonna be able to remember this. 300 to 400 QDS. Okay, 12 to 17. It just goes off the chart. TDS, QDS. So basically, it changes at 10 to 11. The pattern. 10 to 11. Wait, the max OTC dose is 1.2 grams. So there's that. Stop giving me. Stop giving me. What the hell? Oh my god. What am I even looking at here? Okay, that's ibuprofen done. How about mox? Mox. Should I just get down the? Should I just get down on it? 122 is 5 per kilogram. TDS. QDS. But you can't even give that one as OTC anyway. So, and then paracetamol you can only give from 2 months plus. Okay, amoxicillin. Oh, we need to look at adrenaline as well. Stupid. Wait, is it in here? Have I got amoxicillin? Maybe. I don't know. Amoxicillin BNFC. But there's different yeah, but there's different stuff it's for and they're different dosing. Susceptible infections? Should I know that one? There's quite a few different ones. Just remember like the main one. I'm just gonna remember susceptible infections. I don't know. I don't want to ask in the group chat. I'll get ignored. 1 to 11. 1 to 11. 1 to 5. TDS. Then 1 to 4 equals 250 QDS TDS. Then 5 to 11 equals 500 TDS. Max 1 grams. 1 gram max. Okay. And then 12 to 17 equals 500 TDS. Maybe 1 grams. 500 to 1 gram TDS. What's that adult dosing? Adult is 500 every 8 hours. Or 1 gram. Oh, so it's basically the same as adult dosing, then why is it... Are you being serious right now, bro? Are you being serious right now, bro? 12 to 17 is literally the same as the adult dose. So I'm just going, 12 to 17. So let's make that as 18 plus as well. So literally, if you're 12 years old, you can have the same as an adult dose. Dum 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 dum. Wait, even as 5 to 11, you can have 1 gram as well. Wait, 5 to 11 can have 1 gram as well. Oh well. It's just tedious. At least I know that. And that's the same with ibuprofen, TDS. It can be QDS sometimes. um. Okay. How about adrenaline? Adrenaline. Um. Adult versus child. So, older adult child. Anaphylaxis. Nice anaphylaxis. Injected into mid-thigh. Dosage vary by age and weight. I'm putting nice and it's giving me some random guidelines. Are you kidding me? Nice guidelines, bro. Nice guidelines. How did you put that in this search? How dumb is this, man? 12. So if you're 12 plus, you get 500. 6 to 12, you get 300. Then 6 to 6. Ooh, that's a nice number. 6 to 6, 150. Less than 6, you get 100, 250. So 500, 300, 150. So 12. So adrenaline. Adrenaline 12 plus, you get 500 micrograms, 0.5, 6 to 12, you get 300.3, and then 6 to 6, you get 150, 1.15, then less than 6, you get 100, 250.12. If you had like a only an adult pen, are you able, I don't think you can like give partial doses, can you? So if you only have adult pen, can you give partial doses? I don't think you can. Yeah, the dose might fix the dose. Emphasize that delivering a high dose adult pen is safer than no adrenaline at all. An overdose of adrenaline can temporarily spike in heart rate and blood pressure, but untreated can be fatal. Administer the available pen. I mean, 500 to 300 doesn't seem like a massive jump either, to be fair. I guess it depends on the size of the child. Um, use adult pen if only available. Wait, do I have a topic on adrenaline here? Adrenaline. Anaphylaxis. How is that in respiratory? I just noticed. Oh well. Hmm. Also, I want to update something in this. I noticed that when I'm doing exams, come on, come on. Why is it taking so long to load? My computer's struggling. No, not really. It's just got a loud fan now that I did that. Uh, let's see. Adding. Okay. I need to have a look at ranges as well. Wait, use adult pen if the only available pen. Um. Whatever. Okay, so use adult pen if only available pen. Okay. And you give it in the thigh. The adult adrenaline administration image. It's on that part of the thigh. Pull off the safety release. Push the orange and hard into the outer thigh so it clicks and holds for 10 seconds. Just remove the blue. 90 degrees. Push hard until a click is heard. Hold for at least 3 seconds. Imagine accidentally like administering it twice. Is that even possible? Kind of weird. You can do it through the trousers. Please give me advice. Please give me advice. All right, so have I went through everything in terms of that? I guess so. I mean, I haven't memorized the ibuprofen and amox. I just can't remember it though. Okay, I'm just gonna take paracetamol, and I think I know the adrenaline one. Adrenaline one is 12 plus 500, 6 to 12, 300, 66, 150, then maybe under 600 to 150. So go over contraception now. Warfarin, vitamin K. I wonder if I go on flashcard for this, will it? Okay. Mm. Um, it should be hidden really, shouldn't it? The spectrum activity. Should be hidden rather than empty. Vitamin K, rich foods, makes the iron go down. Yeah. Cranberry juice makes the iron go up. Wait, why is that in there? ENT mechanizal oral gel? I guess so. Should I just go through all the warfarin stuff? I need to like throw this stuff in the bin. My pen's falling apart. One second. Turn to antidotes, Viva. Do I remember them? I think so. Indexinate alpha. Or normal Deluxe. Sodium bicarbonate for tricyclic antidepressants and aspirin. Octreotide for. Is it benzodiazepine? No, it was sulfonylurea, wasn't it? Then fluomenazole for benzodiazepines. I think that was it. Ah, there we are. Okay, chat. I think I'm going to do. Yeah, let's do the warfarin one. Bleeding straight away, vitamin K. Oh, was this PCC? I forgot, man. PCC warfarin. Prothrombin complex concentrate. Restart warfarin after INR is less than 5. So you can start it when... That doesn't sound right. Warfarin when it's less than 5. How to manage warfarin Dosing, bleeding, flash INR. Oh, it is less than 5. So major bleeding. Um, Key interactions. Where's the actual treatment? IR not in range. If the INR is high and is greater than 8, stop warfarin. Arrange hospital for phytomenadione. What's phytomenadione? Oh, vitamin K. Phytomenadione. Oh, it says it here as well. Phytomenadione. So if it's greater than 8, stop warfarin, of course. Restart it when it's less than 5. Restart when it's less than 5. 5 to 8. You do the same. 5 to 8 with no bleeding. Monitor INR closely. Withhold the warfarin doses. So 5 to 8, you don't have to really do as much, I think. Prothrombin complex concentrate. So 5 to 8 is no bleeding. I think you can just refer to GP. But apart from that, everything you have to just give IV, vitamin K. It didn't say when to give oral, when to give normal. Oral is given when very high INR, no bleeding or minor bleeding, or when an asymptomatic patient has an INR between 5 to 9 but faces. If the INR remains too high. What? I know 3.5. UK protocol specify using IV solution administered orally, mixed into a small cup of water or juice as it is absorbed more reliably. That's crazy. And why did the game say if patient's INR is still too high? Major life-threatening IV like and PCC prothrombin complex. For major surgeries, they want INR between 1 to 1.2. Guarantee last trace of warfarin overnight, ensuring the INR drops safely below 1.5. So it used to be 1 to 1.2. So see this sort of weird stuff I wouldn't know. Cardiac. So cardiac surgery. So surgeries. Are these major surgeries only? Major surgery. So 1.1 to 1.2, less than 1.5, not good. INR. So if there's no bleeding, then basically you just use oral. Okay. Vitamin K oral, and then 5 to 8. No bleeding. You go to the GP. But then, what do you do if it's like 3 to 4? So you just go to GP. So you contact your GP. If you're not bleeding, you contact GP. If you're minor bleeding, then same day assessment. No. 3.5 is the current VT. Clostrimazole. I'm pretty sure that's not right. Isn't there interaction? Do not have an established interaction. So clostrimazole is a safe one. I did not know that. I need to look at my thingy sheet. Mm. Mm, 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 mm. What does that mean? Recess control if time in therapeutic range is less than 6. So if you time in therapeutic range. Um, I'm gonna quickly go downstairs. I just need to just check some stuff, and then I think I'm gonna go through ranges for meds. So I think warfarin we kind of went through now. We need to go through contraception, vaccines, and ranges for meds, and maybe a little bit about nitrates as well. Yeah, we'll look actually. What do you have on nitrates? Nitrates. Okay, I'll go on over that. Maybe I'll go through some MHRA warnings. These are really like in depth though. I don't know if I'll be able to remember them all, but I think I'll just go through some. Right, chat. I'll be back. Okay, anyways, carry on. Man, I really want to like not do this. Oh man, okay, fine. I just gotta force myself through it. It's really weird though. This year, I mean, well, I kind of know the reason why, but you know, I've been cursed. But yeah, this year I haven't been as motivated in the past, even though it's my career on the line. But you know, it's strange. You know, um, what the hell? Okay, anyways, so wait, can I just search something? Just search. Um, search. Ooh, that is a big jump, to be fair. Mm, mm-hmm, mm, that's a big jump. That's a big jump. Let me just see something else. I have that much. Interesting. Very interesting. Trabian, Trabian. Mm, 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 mm. So I did cash in on the drop chat, so that's good. It seems like I made a good investment because now everything seems to be going up now. Hopefully, it just carries on that way. Last month I lost quite a bit, to be fair though. So in the last 24 hours, made quite a bit. Last month lost 8%. Last 3 months, 12%. So as long as this month carries on going up, should be fine still. To be honest, I'm still in the profit. But yeah, the last day or so was not good. Watch list. Yeah, that's watch list. Where's the global markets? Most owned? Yeah, most owned. The market seems to be recovering now, even though not as much as my portfolio. So interesting. Very interesting. Very, very, very interesting. Most owned. Hmm. IPO. The company has set its institutional offering price and will become publicly traded soon on 12th of June. SpaceX stock. Okay. I think I'll do another profile mace one. Even though these are like, I hate when they make you look through resources. It's so dead. So dead. Alright, I need to look through ranges, vaccines, contraception. Okay. Let's go through this. Once daily. Dinitrate is twice daily. Asymmetric dosing. 9 a.m. to 5 p.m. Asymmetric. Also like in the morning and evening. More commonly used. Absorbed directly. Alright, so dinitrate is the prodrug and it turns into mononitrate. Headaches and flushing is common. I think I know it though now. So what do I just remember that from that? Dinitrate is the prodrug. 9 a.m. to 5 p.m. Asymmetric dosing. You need a nitrate free period of 4 to 8 hours. I think it's more than that, isn't it? Headache and flushing and common side effects. Yeah, I kind of know it already. Tolerance 4 to 8 hours. Real patches overnight. Asymmetric or okay. I think I kind of actually know this one, to be honest. And this nitrates are absolutely contraindicated. I know that one as well. It's really weird how this doesn't update. Need to fix it. Is it fixed? Um. The bottom drawer. Okay. Alright, so we've done nitrates, 4 to 8 free period, needs to be asymmetric dosing. Let's look at a range for medicines. I don't know if this is going to be in there though. Digoxin. Hey, see, there's different things. Someone once said 1 point above 1 is too much, 0.8 to 1 is the best. Now I'm seeing different. Let me see what Gemini says if I just put it into Gemini. Is this true? Must be taken 6 hours after the last dose. And if HF is heart failure is in sinus rhythm, there's no loading dose. So you need to double the dose for a day for loading of digoxin. Heart failure 0.521. Oh, because I am think of lithium. So see, this is this bad because I just thought of lithium when I'm thinking about this. This is 0.8 to 2 and it's 0.5 to 1. You don't need serum, renal function, interacting drugs, routine monitoring not recommended. Eight to 12 hours, but you need to at least have 6 hours. Mm-hmm. 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 0.4 to 1. I swear I saw 1.2 somewhere. Elderly acute mania. Calcium electrolytes. What do you have to monitor calcium? Calcium monitoring in lithium. Hypercalcemia. Oh, because it can alter the parathyroid hormones. Rifampicin. Let's see if this is done. I think I can push this now. Oh, git add, git commit. Bunch of fixes. Git push. Sync changes. Republish. I wonder how many times I've published this. I must have like updated like a billion times by now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Oh my goodness me, it just keeps on going and going and going and going and going and going. I couldn't even count that if I wanted to. Updated the site a billion times. Cool. And each publish isn't even an update. Like that's like several updates sometimes. Anyways, so I'm gonna turn this off. So did I basically went through. I'm gonna actually get ChatGPT just to tell me all the ranges. Tell me all drug ranges I should know for exam. Let's see. Ibuprofen's 2.4 grams on prescription. 2.4 grams per prescription. Ooh, the site updated. All right, let's see now. This should have updated. This didn't update. Okay, so it's telling me. Okay, therapeutic drug monitoring. Phenytoin is 10 to 12, 10 to 20. Theophylline is 10 to 20. Joxin's 0.7 to 2. Did I say? Okay. Wait. The Joxin range. The Joxin range, nice. 0.5 to 2. Above 2 is toxic. Theophylline. I need to actually have a look into theophylline as well. Actually, I have no flipping clue how it works. Or theophylline. So ranges are 0.4 to 1 lithium. Lithium 10 to 20. Phenytoin 10 to 20. Theophylline. And then digoxin equals 0.7 to 2. Okay. Let's have a look into theophylline because I always get confused. Do I not have theophylline here? I'm sure I do. Is it under something else? Because why do I not have theophylline if it's not in there? I'm sure I have Theophylline. I'm sure of it. No way I don't have it. That's actually mad. How do I want to Lucas but I don't have Theophylline? Cysteine. Oh well. Let me have a search about it then. What the hell? This top 100 GPHC drug facts to memorize. What is ChatGPT saying? Wait, what? If you're sitting the exam soon, I can give you a top 100 GPHC drug facts to memorize. A true 100 top 100 would be very long. What? Why is it like... I literally know all of this that it's telling me already. Okay, let me just have a look at Gent and vancomycin range. Gent range needs to be between 1 and peak is between 5 and 10. Oh, that's once daily. So, I mean, it depends then, isn't it? That one's not even... Well, Vank. $10 to $15 or $10 to $20. Standard and severe $15 to $20. So it's $10 to $20 as well for Vank. Vank. 5 to 10 for gentamicin. Peak is 5 to 10 or less than 1. Or 3 to 5 as well. So it can either be 3 to 5 or it can be... So it depends on if it's multiple times or not. Alrighty. I reckon... So we went through ranges, vaccines. Do I need to look through vaccines? I hate vaccines. I think I just asked ChatGPT about that one as well because there's just too many stuff. I have to look for that. Teach me Live vaccines. So those are the MMR, chickenpox, nasal flu, rotavirus, yellow fever, BCG, flu injection, HPV can't replicate, meningococcal, hepatitis, COVID. So it seems like so it's very, very difficult to remember all of these are. So if I just remember like MMR, varicella, influenza, rotavirus, BCG, yellow fever, I know that those are the live ones, then I know everything else is the non-live ones. Maybe that's how I can do it. So why are conjugate vaccines used in infants? Better immune response. I can't remember these though. How am I supposed to remember these? You need to remember like the childhood schedule. Vaccine types you must know. Recombinant are the hepatitis and HPV. Live are these. Inactivated are these. The inactivated is influenza injection, but then on top it says live attenuated nasal flu is like okay. That's so weird. Okay. And then childhood schedule. I can't remember these, man. These are too like they're just like a load of waffle. So basically, you get the rotavirus and the 6-in-1. Okay. This is like very like 6-in-1 rotavirus, meningitis B, 8 weeks, 12 weeks, 16 weeks. Pneumococcal. Recommended in pregnancy, pertussis, affects newborn before they can be vaccinated. Influenza, now part of RSV, COVID-19. Live vaccines in pregnancy avoid MMR, varicella, and yellow fever. This is very weird to remember. Imagine it doesn't even come up at all. That's my biggest fear. Imagine just learning rubbish like this. Like it's a waste of time otherwise. MMR, varicella, live, rotavirus, yellow fever. Contraindications. Vaccination should still proceed with mild illness, antibiotic use, prematurity, family history of an allergy, egg allergy. Egg allergy, just continue most of the time. Breastfeeding, you can continue with a lot of these. Intramuscular deltoid, Anterolateral thigh. Multiple vaccines on the same day can be given at the same appointment. 2 live on the same day or separate by at least 4 weeks. Most vaccines never freeze, monitor temperatures, document excursions if accidentally frozen, quarantine the stock, and seek specialist advice. Do not use until suitable. So you just quarantine the stock most of the time. Influenza vaccination inactivated. Wait, so injectable one is inactivated, but the nasal flu is live. Oh, so it's called live if it's nasal flu. Okay. Meningococcal vaccines, MenB protects against AC, W, and Y. Hajj travelers, university students, teenagers. HPV vaccine. Routinely offered to adolescents, not a live vaccine. Safe in immunocompromised patients. HPV is safe in immunocompromised. Travel vaccine. So wait, can you have HPV pregnant? It's not a live one either, so. HPV vaccine. In pregnancy is not recommended. Okay, vaccine. HPV vaccine in immunocompromised patients. Is this wrong then? Why is it telling me it's safe for the immunocompromised? Current or non-infectious unit vaccines. You don't have to fear with other medications. So, yellow fever is live, typhoid no. Yes, oral typhoid. Rabies, cholera, no. Yellow fever is live. MMR is alive, varicella is alive, lave is alive, yellow fever is alive, rotavirus is alive. I think I can remember that. Flu injection is inactivated. So yeah, influenza injections inactivated, but the nasal one's live. Can be given during breastfeeding. Mild illness, not contraindication. Antibiotics are not a contraindication. Store 228. Vaccine must not be frozen. Pertussis and influenza and RSV. Okay, so that's the questions for relating to vaccines. I think it's. Let me try and remember. So it's MMR, yellow virus. Maybe I should just try and remember those top ones there. I feel like that hepatitis and influenza injection are thingy recommended in pregnancy. So MMR, varicella, MMR, varicella, live, live. I mean, MMR, varicella, live, rotavirus, BCG, yellow fever. TB. BCG is the live one. Easy way to remember live vaccines. Very bad. It didn't include live. Very bad MMR. Rots yellow. Fine. You know what? I mean, it doesn't sound that great, but very bad MMR. Rots yellow. Very bad MMR. Okay, I think I need to go through my notes as well. Rots yellow. What's that? Varicella, BCG, MMR, rotavirus, yellow fever, and then live. What does it live stand for again? Live attenuated influenza vaccine. If they just said live attenuated, then you know. What about prophylactic TB or slash malaria? Doxy. What's the other one? Proguanil or something. What's the other one? Metolazone or something. Metolazone? Hopefully it's metolazone. I just put metolazone. Common regimen include isoniazid, pyridoxine, rifampicin alone, isoniazid, and rifampicin. So doxy is 1 to 2 days. Continue 4 weeks. Let me write this one down as well. Doxy. This one's malaria. Doxy 1 to 2 days plus 4 weeks. In children, Proguanil, Malarone. Atovaquone, Proguanil, Malarone. Goes 1 to 2 days. Plus 7 days. And then mefloquine. Mefloquine has near psychiatric ones. Equals 2 weeks plus 4 weeks. Psychiatric. Mefloquine. And then I think, should I go through infections? Because I thought I went through infections, but I forgot about it. Isoniazid. You take isoniazid, B6, and what else? Isoniazid, B6, and rifampicin. We didn't do any ODC. We went through some infection. What time is it? It's 6 now. Okay, I think I finished off the exam that I was doing. I'll see where my... Okay, wait, what did I just go through? I went through vaccines. So, yeah, I just went through vaccines. And then I just want to just search about theophylline. Oh, I need to look through contraception as well. Theophylline. Explain to me everything I need to know about theophylline. Breathing such as asthma. Wait. For GPHC exam. This is asthma, COPD, first line treatment. 5 to 15. What do I have it down as? See, I have it down as 10 to 20. This is the problem. Theophylline. Nice range. Ten to 20. But above 20 is bad. You get fast heart rate, palpitations, nausea, tremor, rapid heartbeats. So everything just moves fast. It's like caffeine, basically. Didn't I see that somewhere actually? Theophylline and caffeine. They're from the same family. I remember seeing that somewhere. Smoking increases the breakdown of theophylline. This is one of the most clinically important interactions. Increases the breakdown, so it reduces levels. Smokers need high doses. Because theophylline is chemically related to caffeine, effects can add together. Mm. Narrow therapeutic index. Kind of already knew all this, to be honest. 5 to 15, 10 to 20. Increases significantly when 20. Metabolized by liver enzymes. Unifilin. I wonder what happens. Oh man, there's a verapamil interaction with something the other day. I've forgotten now. Oh well. Like specifically just verapamil. Oh well. What drug interacts specifically with verapamil? Theophylline. Was it theophylline then? Oh man, it's because I already was asking about theophylline. Let me reload. I was like, what? Nah, it's not getting me. Oh well. Scrap GPS or sickfaces.com. What's sickfaces.com got in there again? Okay, I'm gonna have to go through my notes now. So theophylline, blah blah blah. Okay, at least I know a bit more about it. Should I go to contraception? What the hell is this? Oh, they're like Are these just like how unacceptable they are? It's a 4's the worst. UK Mech. Dum, 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 dum. Stop giving me advice. Migraine with aura at any age. If it's less than 6 weeks postpartum and breastfeeding. Blood pressure is over that. So blood pressure stage 2, major surgery, mobility, age 35, and smoking 15 a day. What? Do not use. Wow. See, a lot of this I actually didn't know. Switch to progesterone only. You're smoking more than 15 a day. Wow, and you're 35 over. So, need review. Less than 6 weeks, you can't. Wait, that was with okay, yeah, combined. I didn't know this. Levonorgestrel and DPMA injection. That's fine. Hmm. Why am I getting tired? Oh man. Um. Do I? Hmm. Okay. I'm so tired, man. Oh man. So tired. Ah. All right. Let's do the exam. Just in the right frame of mind, man. It'd be a shame if I failed now because then I'll have to do all this again. But you know, I haven't been paying attention properly. Stop giving me advice. Stop giving me advice. Wait, let me just search. Oh man, I got distracted and I forgot I was gonna search. Um. Research. Okay, I'll just search something else. Uh, hmm. Okay, I'm just gonna search this. Yeah. I don't understand this. Okay, you know what? I'm just gonna forget that. Okay, let's carry on. I'm gonna go to do the. Oh wait, let's just have a look through my notes so far. Okay, sickfaces.com. Let me try and remember them. Sick faces. So this is the inhibitors. Inhibitors are sodium valproate. Sick faces. Is it isoniazid? Yep, it's isoniazid. I just peeked to look. Isoniazid, ciprofloxacin, ketoconazole. F is. It's not fluclox, is it? Fluconazole. Bro, I am cooked. Faces, and then A, ampicillin, fluconazole, ketoconazole, ampicillin. C is ciprofloxacin. The chloramphenicol, isn't it? Yeah. Sick faces. E is sick face. E is erythromycins, probably. S is sulfonylureas. No, sulfonamides. Ah, man. Let me just see sulfonamides example again. Sulfonamide. Do, 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 do. Sulfametoxazole. No, it's just saying some random sulfur. Anything that starts with sulfur, basically. Sulfur. Trying to see, like I've not seen a single thing. Furosemide sulfur. What is furosemide? A sulfonamide. Furosemide is a sulfonamide derivative. Is inhibitor. Yes, furanate is sulfonamide and acts as an inhibitor. What? This is news to me. No, inhibitor enzymes. Weak, moderate inhibitor of certain enzymes. I didn't know that. I didn't know that. I didn't know that. Like these specific drugs, like sulfonamide, blah 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 blah. Carbonic anhydrase enzymes. Anyway, so what was I doing? Yeah, let's go back from the start. So sodium valproate, isoniazid, ciprofloxacin, ketoconazole, fluconazole, ampicillin. I think is it ampicillin? No, it's alcohol. Shit. Alcohol. Acute alcohol. Okay, let's start from the start. Sodium valproate, isoniazid. Sodium valproate, isoniazid. C is ciprofloxacin, ketoconazole, fluconazole, alcohol. C is chloramphenicol. E is erythromycin. S is sulfonamide. So sickfaces.com. C again. Oh, cimetidine, I believe. OM. Is, I don't know, omeprazole. I think I would know that anyway. Omeprazole, and then metronidazole as an inhibitor. That just doesn't, because you never hear it as much. Okay, metronidazole. So cimetidine, omeprazole, metronidazole. Next is scrap GPS. So smoking is an inducer apparently. Is smoking an inducer? Is smoking an inducer? Yes, it's a powerful enzyme inducer. Okay. Smoking. What's next? Carbamazepine. Rifampicin. Is it ampicillin in this one? No, it's alcohol, chronic alcohol. Okay, alcohol chronically. P. Phenytoin. G. Is it the weird one? Grisafulvin, which is for fungal, I believe. Grisafulvin. P. Is it phenobarbital? Yeah. S. St. John's wort. You know, I think all this thinking actually makes me tired, actually. Does thinking make you tired? Does studying make you tired? Yes, mental fatigue. When learning heavily, your brain forces neurons into local sleep to process data, leading to sudden sleepiness. Pomodoro timer. You know what? I'm not tired. I don't need that bullshit. Alright, let's carry on. Skype GPS DAPT. DAPT is DAPT for EPF syndromes. Oh yeah, that's my own thing that I made up. Adapt. I think they gave a adapt at the start. So dystonia. So sudden jerks. A is akathisia, restlessness. P is Parkinson's symptoms, so like tremor, Parkinson's, tremor. What else symptoms are there for Parkinson's syndrome? What's the other one? And sudden jerking. Yeah, I'll just say sudden jerking. I'm not going to say it. Sudden jerking movements. Tardive dyskinesia, facial movements. Okay, next we have for melanomas, A, B, C, D, E. Asymmetry, B, border, C, color, D. What's D? E getting bigger. What's D? Diameter. Studying makes you see. How to avoid sleepiness while studying. Oh, I'm not sleepy. That's a load of bullshit. I'm not sleepy. Heck. Oh, what are safe for pregnancy? So penicillin, erythromycin, cephalosporins. There's one really weird one. Oh yeah, clindamycin. Drop fast. What's this for? Drop fast is for ones that you have to have on an empty stomach. Drop fast. I remember maybe it starts with like a weird tetracycline. Demeclocycline. Demeclocycline, which is the one that you can do on renal effects. Okay. Demeclocycline. R is rifampicin probably. O is oxytetracycline probably. P is, I don't know. Pen V. Yeah, Pen V, you have to have an empty stomach. Drop fat. F is Fluclox. That's what I was thinking, Fluclox earlier, but it's actually fluconazole for the inhibitor. But it's okay. Fluclox. Drop fat. This way I get confused. Ampicillin's in here, isn't it? Yeah. And then last one's the tetracycline. And what's the next one? MNP with food. MNP. So yeah, metronidazole, nitrofurantoin, and pivmecinin. Oh, I don't know, remember that. Milk is DLM, doxylimecycline, minocycline. Without milk, Cipro, Demeclo, Oxy, C dots. Chadvask. Ooh. Chadvask. 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 So that's the stroke likelihood, isn't it? Yeah, stroke risk. The Chadvask, congestive heart failure. A is age over 75. Then that's 2 points. D is, what's D? Chad. I can't remember. Diabetes. Then V is stroke and stuff. I would never remember that because it doesn't start with V. So like VTE and stuff, so stroke. Or VTE or TIA. So that's the 2 points. And then CVD. What? Where does CVD? How does CVD even fit in there? Diabetes, stroke. There's not even any space for CVD. Oh, there is. Chad S Vask. Chad's Vask. Chad's. There's an S there. A stroke. And then a CVD age 6. Okay, very bad MMR, rots yellow. Very bad. So very. Oh, what is it? Very. It sounds similar. I remember as well. Bad BCG. Very bad MMR. Rotavirus. Yellow fever. Very is varicella. Whatever. Varicella. Varicella zoster. Zoster virus. How did I manage to do this in the past? I just study like 10 hours straight. Don't give me advice. Don't give me advice. Dun, 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 dun. Oh, Mexico versus South Africa today. That will be good. I don't know. I guess I want Mexico win just cause he's in there. The absolute legend. Jimenez. Is Messi a billionaire? Every team's key player. Yeah, bro, Bruno Fernandez is the key player. Okay, wait, is it prayer time? In 10 minutes. Okay. Um. I'm not taking this seriously. Isn't thingy? Top lad. Okay. Anyways, let's carry on. So I was just looking at something. Just because I keep getting these random messages. Clarify. Pause earlier. Regarding prescription dates. Date of prescription included, and then CD add the days on. Okay. Okay. All right, let's see. We're on question, was it 6, 7? Yeah, I think it was. See what I mean? My phone just starts vibrating as soon as I put it down. What is going on? Where's my score? Is it this one? Yeah, it was this one. 1 hour left, it says. Okay, I'll set one for 1 hour. 5 minutes or 4 minutes. 4 minutes. Go. Alright, let's see how we do now. Did a bit of revision, so. Oh yeah, let's see the warfarin interaction with that. 68, a 52-year-old patient is being treated for moderate active rheumatoid arthritis with methotrexate. Okay, 7.5. You are counseling the patient about 1 second, let me just turn this now. Counseling the patient about adverse effects and which one should be immediately reported. Which one of the following is not a liver toxicity in the patient taking methotrexate? You get dark urine, dark stools. I'm not sure about that one. I don't know convert. You get, yeah, so I think it's C. I mean D. No, B. Yeah, you don't get dark stools. That's more melena. Next thing. Broke whenever was a miskin. 69. Which of the following statements relating to Foster 106 is correct? Foster contains extra fine particles of beclometasone. I don't think so. Isn't that the Kevlar one? Is pressurized meter dose inhaler? I think so. Headache is common listed. Once open, was stored in a refrigerator for no more than 3 months. Patients should be advised to rinse their mouths. Foster contains is incorrect. I think it's A, isn't it? Headache. I don't think I've heard of headache either, but I'm gonna go with A as D. Foster should be refrigerated only before dispensing. Oh yeah. Patients collect it must be stored at room temperature for up to 5 months and not 3 months in the fridge. Up to 5 months. It may be stored up to 5 months. All other statements are correct. So what are the other statements? So it contains extra fine particles of beclometasone. Headache, you can get it. Foster, pressure, yeah. Advised to rinse the mouth, yeah. So you need to keep it outside of the refrigerator for 5 months once opened. Under 25 degrees. A 30-year-old woman comes into the pharmacy and speaks to you about her options, contraception, blah blah, following carbamazepine. So that's going to induce it. So that's going to reduce her thingy. So I'm going to go with I think progesterone. We did briefly go over this just now. I think the progesterone based one should be better though. Medroxyprogesterone deep injection. Desogestrel. Desogestrel, right? Oh no. A patch. No. External subdermal implant, I think, is not as affected as much. 1D. A. So it was the injection, because that's just progesterone. It's effective of contraceptive pills, patch rings, pops, and the implant. Oh, so it does, and the implant. I think is the copper, IUD, and IUS are unaffected. I thought the implant, okay, subdermal makes it sound like it's not in the place I thought it was. Yeah, so injections are fine. Where was I? Oh, hey. Yeah, 71. Target may vary from the patient to patient. Which one of the following is the most appropriate for 68-year-old man with CKD who has urine albumin creatinine ratio of 75? Oh gosh, isn't that high? You see, which of the following is a 68-year-old man? 68, 80 or over need 150 or 90. For clinic, I think it's still 140/90. I think I never heard of any different. See, hey, in adults with CKD when ACR is above 70, or if diabetes when CKD with ACR, this patient has both diabetes and if the target is lower. Okay. Oh. So ACR 75. So if ACR 75, if ACR 70, if ACR less than 70, if ACR more than 70, then 130 over 80. Or if diabetes plus CKD plus ACR is more than 3 equals 130/80. 71. Okay, 72. Local primary school has a recent suffering with asthma and salbutamol. Teacher contacted you but by the store. What information will you need to? 6 ventilating inhalers. A maximum of 6 inhalers can be supplied to school in any 1 year. Signed order contained for purpose. Isn't that for CDs? Signed order to request the supplier must contain the names of the trained staff who can administer. Signed order to request the supplier must contain a signature. The inhaler supplied can be used in emergency for a child with asthma. I'm not sure. I just got E. B. Schools may purchase salbutamol for emergency use via a written signed order on school letterhead stating the purpose of supply. Emergency inhalers can only be used for children identified in writing parental consent as having asthma. Okay, so they need parental consent. That's kind of dumb. Imagine someone's kids just die. Okay, well I got that wrong. So they need a written order or signed order stating the purpose of supply. So wait, that's not just for CDs. Worried mom comes into the pharmacy you're working in and requests an emergency supply of salbutamol. You have a pulse oximeter in the store and find that it's 89 and the heart rate is 132. And respiration is 33. Which of the following statements are correct? Are they short breath and the gasping mid-sentence? They need to go A&E. As they are experiencing life-threatening acute asthma, moderate acute asthma, or severe. Before they came out, the mom checked the peak flow rate and it's 45. So below 45, No, 33 to 50. 33 to 50 is severe. C. Come on, that's finally one of my revision actually ended up being in the test. 73. A 42-year-old breast cancer has been diagnosed with bone metastasis in the spine. Ibudronic acid 50. Which of the following is the least appropriate concentration when handing this medicine out to her? Ibudronic acid. 1 hour is a bit long, isn't it? Isn't it half an hour? Report any sign of ear discharge. I've never heard of that. Take 1 hour before first food of the day. Take 1 tablet every day. Take 1 tablet every day. I don't know how. Isn't this a monthly? That looks like a lower dose, so I'm gonna go with the ear discharge. B. Oh, it was D. Take 1 hour before first food of the day. So all of these are right. Ibudronic acid. 50 mg. Is that once a day? Once a day or month. Ibudronic acid is most commonly taken at... Wait, oh, please don't tell me I wrote it wrong. I read it wrong. Which least appropriate? Oh no, I read it right. Strength. Come on. 150 is... So once a month is 150, and then once a day is normally 2.5. And cancer is 50 a day. Okay, well that's why. I got that wrong. Donepezil at night for 3 years for the management of mild Alzheimer's disease. His condition has progressed to moderate Alzheimer's disease, and the GP would like your advice on prescribing additional treatment. So he's got donepezil. You can take Alzheimer's. He's got donepezil already. Donepezil, galantamine, and rivastigmine are the same thing, isn't it? So I think you go to memantine next. C. Ooh, I was about to mark it as wrong. You're conducting a wood run and review an 81-year-old man medication. What is the most appropriate dosage for this patient? Paroxysmal atrial fibrillation. And it's being anticoagulant 5 mg twice daily. He's 81 and his creatinine is less than 120. So that's fine. Oh, it tells his creatinine clearance as well, basically. Um, 140 minus 81 equals 59 times by, what's the weight? 59. Really? 59 times by 1.23 divided by 120 equals 35 creatinine clearance, which is, it was 15 to 29, so that's fine. So he can take the higher dose actually, 5 mg twice daily. This doesn't meet 2 requirements either. Oh, is it less than 60? 81, 60. I think he reaches 2. So I think it's 2.5 twice daily, B. Yeah. Glycerol trinitrate, dizziness and headaches, which is a potentiate the hypertensive effect. Potentiate it. Depends on how long he drinks alcohol for. Least likely. Potentiate the tadalafil, E. What? What does potentiate mean? C is least likely. Oh my days. I can't read. Bro, man, that's annoying me. Therefore, which of the following is the patient most likely to have been initiated on? Facial flushing. Most likely out of all of these. New medication, facial flushing. All of these kind of. I reckon this is CCB because it does peripheral stuff. B? Yeah. See, that's kind of like knowledge stuff. Recently sad. He has a loss of appetite and sleep disturbance. He has just been diagnosed with more severe depression, even more after all that. Oh, I thought he had something. He has also experienced migraines, at least 2 of 3, which he manages well. Which antidepressant is most likely to be prescribed as first line? Sumatriptan. Does that cause serotonin syndrome with this? Persistently fat, sad, loss of appetite. Venlafaxine is going to increase, so I'm probably not that. Amitriptyline, maybe. Sumatriptan. Not. Is this citalopram? First line antidepressant. Well, I don't know with sumatriptan. Maybe the mirtazapine because it helps with his sleep as well. I'm gonna go with mirtazapine. D. C. Lofpromine. I don't know why. I don't know what's lofpromine even do. I don't even heard of that one. I said D. Lofpromine is a tricyclic antidepressant. Best. Both SSRIs and SNRIs cause serotonin syndrome. Bro, I said lofpromazine and they said no. Well, okay. Is it wait mirtazapine and sumatriptan together can increase the risk of serotonin syndrome? Well tolerated and uneventful. Okay, whatever, man. I'm just gonna put that as no mark, but okay. Comes into your pharmacy requesting to buy treatment for her wife. What? Wait, why is this stopped? Where'd that stop? Bro, this is gonna waste my time. Okay, whatever. Carry on. What was I doing? A random thing just stopped for some reason. 32-year-old woman comes to the pharmacy requesting to buy treatment for her wife who's been suffering with constipation for over the last 4 days. His wife hasn't ready. Yeah, which one of the following would be most suitable course? So constipation over the last 4 days. 32-year-old. Lactulose advice, maybe. There's no buy treatment for 4 days. Do you give advice at that point? And then maybe the next, maybe this spagula husk, if not advice. I'll just go with advice because I don't know how long before. Yeah, increase fiber. If these then bulk forming, then osmotic, then. Heart palpitation, shortness of breath, salbutamol for sure. I didn't even bother looking at anything else. Oh, I didn't read the question. Hyperkalemia, which of one of the following medicines is most likely to cause this electrolyte imbalance? Furosemide reduces the insulin. It reduces it. Paracetamol doesn't do anything. Salbutamol causes Salbutamol causes hypokalemia, right? Yeah, it does. Okay, well, that's annoying. Why did it even tell me about the other info? I got that completely wrong because I didn't read the question. What's the clinical difference between clinil modulate and Covar? Covar, I don't know. Clinil is twice as potent? No. Actually, I think it can. Covar must be kept in the fridge. Contain different active ingredients? No. I think Covar is more potent, right? B? But Covar uses extra fine particle formulation that deposits more drug into the lungs. I thought so. That's why I got confused with the earlier Foster question. Mm. 83 fulfill certain criteria to remain registered. Which of those? So they need to do fitness to practice declaration, risk assessment, safeguarding training, first aid training to remain registered. First aid, fitness to practice, risk assessment. I think the safeguarding training as well, but I think it's the first aid training is an essential component for continuing registration. B, C. Not mandated. So you don't need to know first aid according to GPHC. Fair enough, man. Following a review, who is type 1 diabetes, 80 kilograms, isophane, insulin, 3 ml pre-fill pens, 0.8 kilograms, 0.8 units per kilogram. 80 times by 80. So that's 64 units per dose. How many doses do you take? Isophane is intermediate. I don't know how many doses it take. It must take 2, right? Well, the daily dose equates to this. Okay, good. So 300 divided by 64. No, wait, no. 64 times by 300, no, 30, sorry, equals 1920. 1920 divided by 300. 6.4, so they need 7 pence. D. 45-year-old woman comes into the farm seeking advice. So she is nightmares and sleep disturbances after starting new medication. Which of the following is likely to have been prescribed propranolol? D. E. Sotalol. Least likely, bro. I don't know why I keep on. Actually, I would have known. I would have chosen bisoprolol anyway. Sotalol. Water soluble. Now that I'm thinking about it, I just need to look at beta blocker selectivity. I need to just have a look into that as well. Sotalol is water soluble, so no BB. Heart valve. Which of the following would be most? So E, mechanical heart valve. Heart 50-year woman, trigeminal neuralgia, severe face pain was the most appropriate. Is it not like one of these shooting pain alongside one of her face? Amitriptyline, gabapentin, pregabalin. I don't know. Gabapentin, pregabalin. What? I go with pregabalin. B. Carbamazepine. I thought maybe it was that. Carbamazepine. I thought so. I don't know why I didn't think of that. Carbamazepine for trigeminal neuralgia. Yeah, been contacted by the prescriber. Dyspepsia. 16 weeks pregnant. Has already tried the lifestyle suggested to her which of the following would be the most suitable option for her. 16 weeks pregnant. Lifestyle changes. What are these? Are inhibitors? Maybe the famotidine or Gaviscon. I don't know which one. Gaviscon or famotidine. I don't know why I'm thinking not the Gaviscon. So I'll go famotidine. C. It was D. It was the Gaviscon. First line is antacid, famotidine, and PPI is a reserve for severe. So it was just a Gaviscon. I was trying to be smart there for no reason. So Gaviscon for dyspepsia. Yeah, I tried to be smart for no reason. Now look. Kenya sunscreen. 20% DEET. I have no clue what DEET is. I've forgotten. DEET dilute sunscreen. D. Let's see. Dilute sunscreen, so apply it first, followed by insect repellent with the DEET concentration of more than 20%. To be fair, I could have probably guessed that if I looked more. I knew it was dilutes probably. I don't even know what Dietz is though. Why did DEET Israel come up with? DEET is global standard for active ingredient in commercial insect repellent. So DEET and sunscreen. Sunscreen dilutes DEET. So apply it first, then DEET with more than 20%. The vinca alkaloids are used through which route should they be administered? Not intrathecally, intravenously. See. Anti-diabetic drugs. Has been treated for type 2 for 3 years with diet, blah blah blah. As his HbA1c is still not to target, he has been prescribed an additional drug which is available as a once daily or once weekly injection. Once daily tablet, semaglutide probably, or once weekly. G. A regular patient comes in to pick up the repeat prescription. You ask how they are getting on with the medicines, and they mention they have been passing blood in the urine for the past 3 days. Passing urine in their blood. Maybe the pioglitazone because of bladder cancer. I can't think of anything else. What's arcarbos? It is pioglitazone. Bladder cancer. Thought so. What's arcarbos? I don't know what that is. Arcarbos. Type 2 diabetes. Alpha glucosidase inhibitor. What? Nice guidelines. When do you use it? As adjunct therapy for people unable to tolerate any others. Acarbos. BMI 28 brings the prescription for a drug aimed to reduce cardiovascular disease when used alongside dietary measures and increase physical activity. Oh, a lot of those do. BMI 28, cardiovascular risk, reduce. Probably the canagliflozin and the semaglutide, to be fair. BMI with established. I'm just gonna go with to reduce his cardiovascular risk. I think more so maybe that's semaglutide than G. Liraglutide. What? Is it not both of them? Why is it not semaglutide? Why? When the semaglutide also has cardiovascular outcome data, but historically liraglutide is a classic answer when wording refers to cardiovascular risk. Okay. I didn't know that. So liraglutide really good for cardiovascular risk apparently. Liraglutide CVD risk. Mm-mm-mm-mm. Mm-mm-mm-mm. 94. has come in with prescription to be dispensed. She's diagnosed with diabetes many years ago. You cancel her to monitor any foot problems such as pain or ulcers and explain that she should stay hydrated of low limb risk. Okay, so that's kind of gliflozin. B. Prophylaxis of angina. Prophylaxis. Ison. Avoid minor nitrate. There's no other one there, right? Is there? Yeah. F. Oh. Comes into the pharmacy and tells you that he's experiencing some swelling of his lips. That could be Lisonopro. G. Diagnosed with heart failure and preserved ejection fraction. Preserved ejection fraction. Taking furosemide, but this is not adequately in controlling the symptoms. So, which of the following? Select a letter corresponding. What? Oh, okay, wait. Let me read that again. She's taking furosemide, but it's not adequately controlling the symptoms. No. Atenolol, no. Glycerin nitrate, simvastatin, lisinopril. Heart failure. Furosemide, adequately controlling. What do you add as an adjunctive? None of this? Alteplase, no. Amlodipine, maybe. Atenolol, you probably already on bisoprolol. Dapagliflozin. GTN. Maybe the GTN's thing. Yeah, glycerol trinitrate, maybe. Yeah, I'm gonna go glycerol trinitrate. None of this. Maybe amlodipine, but that's it really. Unless Zanopril's already been given, and simvastatin, no, you'd give atorvastatin, so GTN. E. Dapa. Dapa's normally already given. Okay, whatever, man. I think Dapa, isn't that like... I'm so confused. Wait a second. Dapagliflozin. Dapagliflozin. Oh, it was there. Wait, what drugs would the patient already be on? Diuretics, beta blocker, ARB. So they're not put onto that straight away. Maybe I just don't know. Yes. In reduced, also in reduced you always put SGLT too, but in preserved, wait, what? In preserved you also do that? I can't be bothered, bro. This is just random rubbish. But in the other one you put furosemide first. Whatever. I was just trying to flip and squeeze out maybe a mark, but no, not really. Even though I wouldn't have changed a mark anyway. I don't know what I'm saying. Slight swelling on the face. That sounds like mumps. Yes, mumps in it. F. Cluster of raised spots under his left armpit and further down his side. He has had them for around 4 months. They're not painful, but it can sort of be itchy. They have a dimple in the middle. That looks like that sounds like molluscum. If there's dimple in the middle, more molluscum. E. Six to 18 months though too. Pregnant, contact with Anisia now ill. She heard that Anisia infection can affect both her and the baby. She has never had an infection. For which one would it be? It's chickenpox probably. I don't know. A. It's chickenpox. I don't know anything about hand, foot, and mouth. I need to write that on the list as well. Permethrin cream due to an itchy rash predominantly between the fingers. That's isn't that scabies? G. I'm better with skin stuff than I thought. What? Contraceptives. 76. Who requires a form of emergency contraception in 64 hours. 64 hours. How many is that? 64 divided by 3. 64 divided by 24. So that's less than 3 days. Oh, it's been, yeah, less than 72. So then they can just have levonorgestrel. Levonorgestrel 1.5 though. Isn't it over 70? You give double. So Olapriste. Okay, I'm just gonna go levonorgestrel, but F. Bro. Doubling. Okay, I knew that one, but okay. I thought maybe they'll let me double it. With circulatory disease who requires a combined oral circulatory disease. I don't know. Circulatory disease, I don't know. What the hell's placebo tablets? What? I've not heard of that one. I'm just gonna go with low strength combined. C. Okay, I got that right somehow. Smokes, has high blood pressure. Who's looking for short-term contraception for the next 2 months? So she can't have any of the thingy. So the next 2 months. The IM doesn't give you 2 months worth, right? So desogestrel, I think she can take. She can take maybe the injection, maybe the copper ID. I'll go with the copper ID. That's more safe, isn't it? Maybe the desogestrel though. B is the desogestrel. Prayer is the most appropriate. Copper IUD is also safe, but less practical for only 2 months. So how long does the injection last? A month. So Maybe I should just desogestrel. Appropriate short term. If I search, how long does this injection last? Hmm, 12 to 13 weeks. So that's like 3 months. It's too long. She wanted only for 2 months. Legal time frames. Validity of prescription of chlordiazepoxide hydrochloride for each of the following. Duration of time. That just sounds like a standard 6 months, isn't it? 28 days. It's a Schedule 4 drug. It's a benzodiazepine. So I don't know. I didn't know the schedule. I didn't even know it was a benzodiazepine. Phenobarbital 5 days worth for my supplier. A. Other ones you can get 30 days. Length of time required to keep an invoice for a Schedule 3 controlled drug. You need it at least for 2 years. 5 years? It's 2 years, isn't it? H. Duration of time a veterinary prescription should be retained for. 5 years, I'll just say that. I don't know. It's 5 years. That's what I got with that one. Endocrine. General tiredness, feeling more thirsty, urinating more. Troublesome at night. Could be type symptoms built up slowly. Thirsty. That sounds. I'll just go with type 2 H. It kind of sounds like insipidus as well. Was insipidus not gradual? Does. Oh, wait. Should I just copy and paste this question answer? What if insipidus was there? Hmm. Paresthesia in her fingertips, toes, and lips. Stomach cramps, feeling tired. Skin feels rough and dry. Fingernails are breaking easily. Paresthesia. That's gotta be hypoparathyroidism. F. No, the E. Yeah, low calcium, that's why. Over the recurrent thrush infections, fruit smelling breath, unintentional weight loss. That sounds like diabetes type 2 again. I'm going to type 2 diabetes H. Type 1. 12-year-old. Man, I can't read chat. I can't read. Really? How did I not even see the age? Sometimes I don't even... I need to... I don't know. Assay for this drug should be taken at least 6 hours after a dose has been administered. Which of the following statements select the letter corresponding to the drug most likely described from the list above? What? Wait, what? Plasma drug assay for this should have been 6 hours after. That's digoxin C. I was just reading it without even understanding what it was talking about. Patient taking this drug should be instructed to maintain a constant and adequate salt intake. Constant. If it's constant, then lithium. DE. Should write the correct dosing day on both the label and box. Correct dosing day. Oh, like methotrexate. E. On the box as well. I never heard of that though. Yeah, E. Based on clinical judgment, epilepsy. So whether this drug should be prescribed by brand for the treatment of epilepsy is based on clinical judgment. Carbamazepine then by brand. B. Or phenytoin. I've seen carbamazepine normal and carbamazepine Tegretol. Maybe B. Is G. Whether this drug should be prescribed a brand. What? Is this sodium valproate non-branded? I don't even understand. What the hell does that even mean? What? 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 I don't even understand the question now. Yeah, okay, whatever. I'll just carry on saying it's wrong. Childhood vaccinations. First dose should be given at 12 to 13 months. So, of age, 12 to 13 months. What was it? It was, oh gosh. 12, 16, 18. No, it wasn't. I can't remember. Was starting in school at 3 to 4 months. Which of the above vaccinations do childhood vaccination schedules refer to? Childhood vaccination schedules. So I know you need to get the rotavirus early. Influenza at like year 8ish. Measles, mumps ages before that. Menb, measles, mumps, and rubella again. 3 years, 4 months. MMR dose 1 at 12 to 13. Dose 2 at 4 months. That's too hard for me to remember, chat. First dose of vaccine should be given at 2 months of age, and at the second one at 3 months of age. See, I would have went with the MMR for this. So this one's a Menb then. This is what. Okay, I think I actually knew that one. Dose 1 should not be given after 15 weeks, and course must be completed by say 24 weeks. Children aged between 2 months and 10 years. 3 doses. And given in a combination vaccine. Do the following childhood vaccination schedules refer to? 2 months and 10 years. And 3 doses. Probably. Maybe. Is this Menb? One of them's got to be Menb. No. Diphtheria is given the 6-in-1. I just gave myself a mark. Vitamins. Okay, I should know this one. Vitamin A can't be given in large quantities in pregnancy. An adult who's following a vegan diet should take this vitamin as a supplement. Ooh, they're low on B12, is it? D. Okay, chat, we finished it with 5 minutes to spare. But that's actually really good because I didn't even. I was not like going through the questions, like, you know. I wasn't. I mean, I was going through all the questions as well, so that's like. Oh man. Okay, here we go. Let's see how many you got wrong. What the hell did I just do? Oh. Carb 65. I just want to look at this quickly. Urea, respiratory rate, blood pressure, age. All right, let me just do in ChadVask just to make sure I'm not. Actually, I want to write this one on my list, but let me just first try and say the ChadVask one. ChadVask, congestive heart failure, age over 75, Chad, D, diabetes, S, stroke or VT, V is CVD, A is age again. I don't know the ranges. Is it between 65 and 75? 60 to 75 maybe. And then ChadVask sex is the last one. Okay, but what's this? ChadVask age 65 to 74. Ah. Carb 65. Confusion. Urea. Respiratory rate. blood pressure, your blood pressure's less than low. Basically, if your blood pressure is low, and then if you're 65, carbs age is greater than 65. If UV is greater than 7. Okay. And respiratory rates greater than 30. Okay, let's see what mark we got. Did I not feel it? Okay, I don't know. Let's see. So 5, 10, 15, 20, 25, 30, 35, 40, 45, 46. Apparently wrong. Let's see if that's right though. I may have miscounted. Okay, bro, I wanted to flipping heck, 46. Okay. 5, 10, 15, 20, 25, 30, 35, 40, 45, 50, 55, 60, 65, 70, 74. Have I miscounted? 46 means 80. Oh no, I did count right. 74. That's not good enough. 74 plus 9 marks. Bro, I think I was doing alright at some points, but then I got... Oh, man. You know, if I got the last vaccine ones right, maybe I could have pushed myself over the edge. I do want to push myself off the edge, to be fair. Sorry, what was it? Boots 26. What was this one? This one was Boots 25. Oh. Boots 25. 74 over 120. Bruh, it's kind of bad though, isn't it? What was it? 9 plus 9. And this one's 1106. 26. Oh, man. Okay, so what did I not know? Oh wait, maybe I should take a picture with the ChatGPT and then figure out where my weakness is. That's a good idea actually. So that's the one. That's 2. That's 3. 1, 1, 2, 3. Where's the other one? You don't have a loose page somewhere. There's a loose page. So this page is useless. Okay, let's see what ChatGPT thinks after seeing a mess. I guess I definitely need to know the vaccine stuff. Even though I really don't want to, but it's like, fine, I'll learn it. um, Alright, let's see. Photos. Done. From my notes on what I got wrong, can you figure out what topics I need to go through? Yeah, on the GPHC mock exams. It says contraception. That's the respiratory stuff. Should I go to respiratory? I think that's a good idea. More likely to come from tightening guideline knowledge. That's a problem, bro. And guidelines are just like a waste of time. You can just look at guidelines anytime. That's not actually knowing. That's not actually core knowledge. That's what ChatGPT thinks anyway. It says the guidelines. You need to look at guidelines more. Oh man, should we go flashcards respiratory then? If a patient comes in with confirmed asthma, is still on SABA only treatment from all the guidance, what should they be changed to? Just MOT? Oh, yeah, no, not MOT, air. If asthma is uncontrolled on a regular low dose ICS or low dose ICS LABA plus SABA pathway, what should be considered low dose LABA plus SABA? Doubling the dose, increasing the dose of ICS. Wait, what? It didn't even say consider changing to low dose MOT. I mean, it didn't say it was on MOT in the first place. I wouldn't know that anyway if I knew what it's talking about. If asthma is uncontrolled on a regular moderate dose ICS or moderate dose ICS plus LABA, then MOT therapy again, but a higher strength MOT. Diagnosed in adults and young people using current. Nice. So young people, they use ICS. No, they use SABA or an ICS if that's uncontrolled.
And adults then what? Oh, has diagnosed. Ooh, measure. Okay, this is stuff that's good to know. Actually, to be fair. So FeNO first. All blood is xenophils. Xenophils for asthma. Diagnose. FeNO at least 50. 50 parts per B. I don't know what that means. Then use, if not confirmed, then use not confirmed, use broncho reversibility. FEV1 increase at least 12% and 200 mil or at least 10% predicted. What is this even talking about? Twice daily for 2 weeks. Okay, so if that's so that's spirometry. That's spirometry. And so if that's not, then the PEF. Variability. What is the treatment pathway for 5 to 11 newly diagnosed SABA and then ICS? Or is it the opposite way around? It's ICS then SABA, twice daily. ICS SABA. MOT. So low dose ICS and SABA. What's the initial approach for suspected asthma in children under 5? I have no idea. No, I'm gonna do. I think I'm gonna go to vaccines. Wait, do we have flashcards on vaccines? That probably helps me learn quicker. No. Maybe I can go CAPI vaccines. Come on, Cappy. Show me you're made of. Go on, lad. Go on. Go on, lad. Go on, lad. Go on, lad. Start. Ask when pregnancy she should receive pesticiders to give her baby the best early protection against whooping cough. I have no idea. Okay, 16 to 32. That's a that's wait what? 16 to 32. That doesn't sound right. At any time in the first trimester. I think it's at any time during the pregnancy. I didn't know there's any of this. 16 to 32 weeks. No, that doesn't sound right. Yeah, that doesn't sound right. Is scheduled to receive his rituximab. He asks which vaccine he should receive to maximize protection. In 2 weeks. Six months after. Long-term warfarin attends the pharmacy for his annual intramuscular influenza vaccine. His recent INR measured yesterday in clinic was 3.5, and he has no bleeding history. INR intramuscular. Delay the vaccination. Intramuscular injection. Give the vaccine. Subcutaneous is dead because subcutaneous has the same efficacy and no bleeding risk. I think it's acceptable, isn't it? 3.5 is okay for some people. Oh, a target INR is 3. I mean, 0.5. This is hard, chat. Yellow fever. Now MMR 7 days ago. You can't have. You have to wait 4 weeks before that. 2 week interval is not enough. A whole month's worth. Ten days ago. MMR vaccine. Asked whether she can receive MMR at a. Huh? 10 days ago. Is this the exact same question as the last one? Crohn's disease, South Asia, typhoid vaccination. Wait, there's different typhoid. Mm, anaphylaxis to eggs. Wait, one of them is ChatGPT. Oh man, I forgot you were streaming. I was watching the start of the Maxi match. Ooh, I can't wait. Hopefully Jimenez scores some goals. He just joined Wolves again. Let's go. Let's go. In Egalogy. I want to watch that on the side, to be fair. I want to see Jimenez score some goals.
Egg allergy, MMR. I don't know. I actually don't know. Varicella. Wait, is it varicella here? Oh, never mind. I thought maybe it's the varicella one. Wait. Oh, never mind. Today, the employer requests proof of measles immunity and offers. Oh my days, you're so hard. Yesterday. Wait, is that a live one? Live attenuated, okay. It's scheduled to start adalimumab. Bro, there's so much stuff here. Give the inactivate today, but defer until she has been treated. Eight weeks pregnant, reports she has never had chickenpox, and her antenatal notes show she's negative. She's exposed to shingles. Oh gosh. Avoid this because it just has these brackets. Immunoglobulin. Refer for obstetric review. And I know this is like urgent. This is a bad one. I don't really follow football. I'm just watching out of curiosity. Start watching it then. Let's go. The best player. You should just know your best player is Jimenez. That's all. Finish. Right, I literally got smashed on this one. This one's difficult. All of these are difficult, to be fair. MMR booster and the inactivated today, and postpone starting. Oh, I didn't even read. I should have read that, to be fair. This is too much reading for me. 4 weeks before any immunosuppression, you have to do 4 weeks before. Egg allergy. I don't know. So yellow fever is produced in egg substrates and contains enough residual egg protein that contraindication. So yellow fever. Yellow fever. Yellow fever equals egg allergy. Pertussis is 16 to 32. Pertussis 16 to 32 weeks. Should I do another mock? I think I'll do another mock and see if I'm actually cooked or not. Actually, I need to read through my notes, I think. That'd be a good point to do. Read through all my notes and then try again on another mock and see if I'm actually cooked or not. Because ain't looking good, fam. Ain't looking good. Why is that under respiratory? Okay. There's no vaccines here. Whatever. How's that a mixed topic? Wasn't it just only vaccines? Goalie straight knocked the ball to the side. Wait, is the opening games free? Hopefully they are. Let me see. Mexico. v South Africa. Watch ITVX free. Accept. Watch live. Continue with Google. Continue. I'm surprised it's actually free. I guess it has to be. Alright, I've got it live now. Wait, can I like... Oh, you can't even do picture in picture on this. Stupid ITVX. Come on, what was that, mate? Oh, if Jimenez does good on this one, then maybe we can be hopeful for the start of Wolves at in Championship. Come on. Come on. Come on. Bang! Oh, he missed. No, well, he didn't miss. The guy saved it. Who shot there? Oh, that was that Jimenez. Bruh, that was actually a good shot as well. Bro, he fell over from like hitting it with that much power. Bro, the roll to not let it in. Bro, that was actually a power shot. He fell over. That was a good shot though, to be fair. I think he just tried to hit it again, but like, oh no, they're on the counter attack. Okay, what was that? South African player, I don't know what you just did there. I don't know how the goalkeeper saved that, you know. I just looked at the replay, that was crazy. I'm watching it in Spanish, so I get the legit experience. I wonder if I can change. I don't think I can. That's funny. Bro, Spanish commentary is so much better, I think. World Cup stream. Live World Cup stream watching. Well. I think I'll start another mock. We'll do another mock, I think. I want to see if I'm actually cooked on. Oh yeah, we need to look through my notes. Let me have a look at my notes. Ooh, wait, my phone. Why rated that with a trading? Uh-oh. Did something drop? Let's see what dropped. Went up. Ooh, 10% rise. 10% rise. Ooh, making quite a bit today. What the heck? Ooh, everything's recovering. This is beautiful. This is beautiful to watch. Absolutely beautiful. I'm still on a loss on with that one though. That's hilarious because it dropped by that much. Oh well, that was projected to and a bit more anyway. Okay, anyways. Let me have a look at my previous notes. Oh, what was that sound? I just heard like a... Was it a Spanish player? That did not sound like Spanish. It sounded a bit like Chinese. Someone screamed. Dude in cornrows. Hey, well, I'm like, I've seen some American videos or like some YouTube or something, and then there are some there are some Mexicans that um seem to seem to like. Wait, they? Oh, okay, never mind. Never mind. I'll just keep my mouth shut. Oh no, that was a risky. That was risky. I knew that was risky. I was like, what? Shoot! Hey, hey, the dude in cornrows. I knew that was risky. I was like, why is he doing that? The goalkeeper. Oh, yo, what's this? That's a cool celebration sound. It was the cornrow guy. Hey, that's a cool celebration sound. Is that a famous song or anything? That's a sick one. What's his name? Quinon. I don't know how to say it. Quinones. Quinones. That's hilarious. Oh, Quinones. 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 Yeah, I knew that was risky. As soon as I saw him do that, I was like, that's a bit dumb of him. Terrible goalkeeping. That's a foul. Foul! What? What happened? Everyone's diving and rolling now. Who does Quinones play for? Oh, he plays for Saudi League. That's why they're talking about Ronaldo and stuff. I was like, why are they talking randomly about Ronaldo? Plays in Saudi League for Al Qadsiya. Is this guy chewing gum while playing? Hit his foot, not his leg. I mean, normally it's a foul anyway. I don't know. It depends if they're trying to get the ball or not. I mean, no, it depends. If he successfully got the ball and then they hit the leg, then it's not a foul. But if they hit the leg without getting the ball, then it's a foul. Or hit the foot without getting the ball, it's a foul. Patient is on atorvastatin, levothyroxine, dyspepsia, nifedipine. That sounds levothyroxine, maybe. Or nifedipine causes it. New onset dyspepsia. In school, we used to straight beat each other. Yeah, school's different. School's different. These guys are professionals. They have a long career ahead. They can't afford just getting kicked in the leg for no reason. Infliximab, normally 14-week treatment. After the first 3 doses, then continued therapy should be considered. Dyspepsia. It's not levothyroxine or metformin. Metformin can do it. What's nifedipine? I mean, I know what nifedipine is, but what can it cause it? Is an uncommon but well documented side effect of taking nifedipine: heartburn, nausea, and indigestion. Oh man, I think I remember reading about this. Why does the dude keep on panning to the guy? Looks like Steve Harvey but malnourished. Yeah, you talk about the guy that just keeps on chewing gum on screen. I can't. Steve Harvey. I don't see anyone else with. Did he have a mustache? I don't know. That dude, yeah, that dude just chewing gum while on the pitch. I don't know. I guess that guy, the guy that just kicked it out, malnourished. He is chewing gum. Maybe it's nicotine gum. Some of these are like high stress environments. Some, footballers they use what's it called, sinus. A lot of footballers actually, because of the stress, that can cause gum cancer. I just want Jimenez to score, bro. Wait. That dude looks like a Portuguese player that I know. What's his name? Semedo. I love this referee cam, man. It's funny. Yo, you have a good winger. Whoa, he's taking on like two of them. What? That guy just died himself. Yo, who's that? I didn't even get to see his name properly. Started G. Bro's trying to do some Ronaldo 08 Manchester United antics. Ooh, that's a nice long ball. Doo-doo. Ooh. Yeah, that's a foul. That's a foul for sure. See what I mean? He went for his legs instead of hit the ball. I love how they dive though, because that was not that bad. Oh, actually, maybe that was bad. Oh. Oh, okay, never mind. He barely clipped him on from the other angle. From the one angle, it looks like he's fully like stamped on his foot while he's in the middle of moving. Who are they booing? Anyway? Oh yes, pressure him again. Make another mistake. Come on, no. Steve Harvey. Was he? What is the goalkeeper there with the ball for someone? Bro, are they gonna time waste the whole rest of the match? Look, they're just standing there. They're just gonna time waste. No, this is peak for South Africa. Oh, okay, never mind. They're trying to get something going finally. That's bad for him, as he shouldn't be doing that. I don't think. Mexico's team is actually better than I thought, or maybe it's just that South Africa's really that bad. They're like they're playing like Barcelona or old Barcelona. Boom. Oh, is he the best player or something? Cornrow guy. That was actually neatly close. That was quite close though. Quinones. Quinones. That now I'm thinking about it, that referee cam was terrible. Like it was not high quality at all. It looked like some ancient tech. What are they screaming about? I don't know. Oh. Okay, I'm gonna mute this now so I don't get distracted. But I'll keep it on the side so I can see. Wait, is it prayer time? Might be prayer time for me. Yeah. 9:33 is gonna be next. Okay, I'm just gonna pray and then just check something downstairs and I'll be back. All right. See you in a sec. Character category. Okay, anyways, continue. Is there no way to... Oh, whoa. They just got saved. Bro, who just shot that? I didn't see that. Oh, was that Jimenez? I didn't even see that. I wasn't even looking. Oh, that would be... Oh, he saved it. Bro, he... Oh, it is. Oh, he did. He barely hit it there, too. How does he keep on saving Jimenez's shots? It's annoying. Let him get a goal. It's annoying. Oh, here we go. Another counter attack. Bro, they're destroying South Africa. Oh, okay, never mind. Shot. Shot. Oh, no, miss. Oh, come on. Come on. Ooh. That South African attacker was dancing on the ball. Man, how did he miss? Did I have a good goalkeeper? Oh, actually, no, he wasn't good because he has been saving a few shots, but he made a mistake and then Jimenez got the goal. Anyways. Roxicam.
Ooh, this play is actually good. Who's that? Yo, what's his name? Miyakazi. I wasn't even looking properly. Plays for Chicago. That was a really good shot. Wait, was it hmm. Okay, let's see. Flashcards. Hmm. 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 Okay, man. Okay, I'll wait up to go eat food now. Okay, 1 second. Okay, so I think what I'm gonna do is go through my notes first. Okay, anyways. So nice. So Jimenez got a goal as well. That's good. Mm, 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 mm. Whoa! South Africa have two red cards. What are they trying to do, bro? Kill the opposition. The cartel's grip on Mexico behind the World Cup. What? Hmm. Oh, they own hotels and restaurants over there. Hmm. So I was reading through my notes, and some of this is interesting.
Okay. Hmm. 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 This notes are trying. Some of this is not good. Hmm. Where's my pen gone? Yeah, here. So, amphotericin B. I'm gonna turn that one off actually. Yeah, bites comoxiclav or metronidazole or doxy plus metro for 3 days for prophylaxis and then 7 days treatment. EPS symptoms. days recovery. Acute asthma is 94 to 98. Then takes 5 days to recover. 40 to 55 prednisone. Lyme disease. Doxy. Doxy can have pregnancy. What? Avoided. How about Lyme disease? I was gonna say. What the hell is that picture? Is it full time yet? Mexico. Today full time, yeah, 2-0. Bro, they got. Is it? Huh? Oh, that's when they got red flag. Oh, there's 2 red cards. One on that side and one on that side. Wait, there's 3 red cards. Okay, so. Yeah, so 200 once daily, 21 days, but a max 1 gram TDS for 21 days. A max 1 gram isn't the reserved for higher worse infections, huh? Okay, so piroxicam, ketoprofen, and ketorolac. Piroxicam. What is GI risk? High risk is ketorolac, piroxicam. Where's ketoprofen? Celecoxib is actually low GI risk. Celecoxib. Oh, it's because it's COX-2 in it. It's
spares progastins in the stomach. Yeah, prostaglandins. Yeah, that makes sense. Okay, so that kind of like clears it up for me. Piroxicam. Then which ones have the highest NSAID with cardio risk? Diclofenac high dose, helicopsib. Low risk naproxen. One to three tramadol. So the ones that you can keep outside of the CD cupboard. Quinobarbital, which is Schedule 2 one. Then the one that's Schedule 3 is tramadol, gabapentin, pregabalin, midazolam, and phenobarbital. Midazolam, I need to remember, and phenobarbital. I think I remember those outside. I think I remember people putting midazolam in the thing, which is why it's confusing me. Where's my cheat sheet that I made? Where did I put it? Did I not rip it off yet? Or did it? Bruh, why did I make this part messy? Should have kept it neat. Oh well. So quinobarbital, then tramadol, gab, pregabalin, Midazolam. And phenobarbital. 5. 1. Prolactin. Make fecal lacturia. EPS symptoms. Tremor slow. Tardive dyskinesia. Dystonia. Muscle spasm. Restlessness. Akathisia. If it's 12 hours, and if you have desogestrel and you miss more than 12 hours, then you take LO1, and for 5 days you stop the desogestrel, and for 7 days you use the barrier. Lithium, 12 hours, check range. Aripiprazole is prolactin sparing. Prolactin sparing is aripiprazole. QT prolongation is haloperidol. Fosfolipid, potential clozapine, clozapine, olanzapine, high weight. Clozapine, you need to monitor constipation. Epilepsy. For 2 to 6 months. Focal levetiracetam lamotrigine. Focal use levetiracetam and lamotrigine. What's it called? GTC, what's that? Is that grand mal basically? Grand mal. Use sodium valproate, then lamotrigine. So focal, you always use levetiracetam or lamotrigine. Then absence, use toxoximide. The hell did I just see?
just look at the time. I think I'm gonna call it early night and then try and wake up early tomorrow, even though I say that every flipping time. But yeah, all right. See you guys. Bye.